Hello, I am Kian Marie Balahay, a Level 3 nursing student from Visayas State University. And today, I'm going to perform the essential intrapartum and newborn care. So, the essential intrapartum and newborn care is a basic component of DOH maternal, newborn, and child health nutrition, or the MNCHN strategy. The DINC practices for newborn care constitutes the theories of time-bound, chronologically ordered, and standard procedures that the newborn receives at birth. So, before we begin, let's discuss some important information in conducting the procedures. So first, let's talk about the positioning. Within the 90 minutes of non-separation from the mother, the newborn should be prone at chest. Newborn's neck is not flexed or twisted. Newborn is facing the breast of the mother and close to the mother's body. Lastly, the newborn's whole body is supported. So second, the pharmacology of the prescribed administration of CRIDS prophylaxis or the erythromycin ophthalmic ointment, then the vitamin K, and the hepatitis B vaccine. So the CRIDS prophylaxis or the erythromycin ophthalmic ointment is classified as a topical antibiotic. So the dosage should be 1.5 to 1 centimeter each eye. Possible adverse effects will be mild irritation to conjunctiva, slight blurring of vision. Then, the action is effective against gonorrhea and chlamydia organisms, drug of choice for eye prophylaxis at birth. Then, the vitamin K. So, the dosage for vitamin K is 0.5 to 1 milligrams. The possible adverse effects are local irritations such as pain and swelling at injection site. The action, it is used to prevent the untreated hemorrhagic disease in newborns. It is necessary in the component for the production of certain coagulation factors and is produced by microorganisms in the intestinal tract. Then lastly, the hepatitis B vaccine. So it is classified as a topical antibiotic. So the dosage is 3 doses to be given at 0, 1, and 6 months of life. Possible adverse effects could be sore leg from the shot and low fever less than 37.8 degrees Celsius. Now let's discuss the 4 newborn care practices according to the DOH protocol, the unang yakap. So first, immediate and through drying, early skin-to-skin contact, properly timed cord clamping, and the non-separation of newborn from mother for early breastfeeding. So now, we're going to perform hand hygiene before performing the procedures. So, then, after that, don mask and cap properly. Mask. Then cap. Next, introduce self. Verify the client's identity. Then introduce self. Then explain what you are going to do, why is it necessary, and how the client can cooperate. So in this way, it will promote rapport and then promote client cooperation. Then, now, we're going to prepare for the needed materials. Don gloves. So now we're going to perform the eye care using the erythromycin ophthalmic ointment. So So we're going to get, first we're going to gently pull down the newborn's lower eyelid. And then, extrude the line of the ointment and length of the lower eyelid from the inner canthus to the outer canthus. So, palawas. Then, close the eyelid and count then 1 to 5 to allow the absorption of the medication. Then, wipe away the excess of ointment from the child's eye. So, perform the same procedure in the other eye. And close. So now, first we're going to prepare for the 0.5 ml hepatitis B vaccine. Next, wipe the site with a wet cotton ball. So the site of the injection will be the anterolateral aspect of the thigh. So wipe it, then administer. So, we're going to administer it through IM. Next, we're going to administer the vitamin K. So, prepare a 0.5 ml of vitamin K. Then, wipe with cotton balls the anterior lateral area of the thigh. And then, administer the vitamin. Assess for the signs of bleeding. Then check the newborn's condition and the vital signs. Lastly, do the aftercare. Then, after the aftercare, document the name of the drug and the vaccine, the time, amount, and the route of administration, nurse name and the signature, then other nursing interventions, and report the unusual to the physician or the resident on duty. Now we're going to bath the newborn. So first, we're going to prepare the needed materials. So a basin of water, then a soap, then a comb, a towel, and a cloth. And then, light wool with hood. Then, assemble all the needed materials, all the needed equipments, so the baby would not be left exposed unattended while you go for more equipment. Then prepare the room. So make sure the room is about 24 degrees Celsius so that we can prevent the baby from having hypothermia. So bath the baby from the cleanest to the dirtiest, so from the head to toe. So wipe the newborn's eye with a washcloth. So from the inner canthus to the outer canthus. So make sure that when you clean the other eye, the clean part of the cloth is used to prevent the spread of infection. Then wash the face with clear water only. So, clear water. Then, wash the baby's hair with soap and water. So the soap here with water. Then to the lower part of the body. So we should take care not to soak the cord. So wash the genitalia. For females, wipe the front to back so that we can prevent the spread of contamination of the vagina or urethra by rectal bacteria. Then, Wash it from front to back. And close the baby. Then, do the aftercare.